What are we gonna watch?
Oh, let's see, I don't know.
I don't even know how to turn the TV on anymore.
Oh, look, it's Jaws.
Oh my gosh, we haven't watched that in forever. I'm Kim, and this is my son, Jordan. He's 29. We live in Nashville, Tennessee, and Jordan has wart-like bumps on his face.
They're proboscis.
Yeah, like a proboscis monkey.
So, but they don't have bumps.
No, they just have a big nose.
Like me?
Yeah. Jordan's bumps are in a butterfly-shaped pattern across his nose and his cheeks. Some are small, some are as big as pencil erasers and very vascular, so they bleed. Jordan has autism. Jordan is a really upbeat and positive person. He laughs a lot. He has a good time. The bumps affect him every day. So tell me about your bumps.
They hurt.
Where do they hurt?
Here.
That one hurts? Anywhere else?
That one.
Yeah. So Jordan will come to me and tell me that they're hurting or that they're bleeding or that they're bothering him.
Pestering?
They're pestering you, yes.
Yeah.
Jordan lives in a fantasy world. He's obsessed with vampires, so he has capes and crowns that he wears.
And medallions.
Oh, and medallions. So when Jordan was 11 months old, the doctors diagnosed him with tuberous sclerosis. A side effect of tuberous sclerosis is the butterfly-shaped pattern of bumps on the face. Around the age of 4, his face was pretty much covered in the bumps, and we wanted to address it. And so we saw a plastic surgeon who at that time said the best option would be to laser the bumps off. Jordan was put to sleep, and literally his face was burned. It smelled like burnt flesh, and it looked incredibly painful. And as a mom, it was very heartbreaking to see that. When Jordan woke up, he could smell his skin, and he was crying because it hurt. And he literally grabbed his face with both hands and ripped the burnt skin off of his face. It was horrible. I decided that I would never put him through that again. And within a year, the bumps started to reappear. So it was like we did it for nothing.
There are a lot of patients who obviously have experienced previous trauma that have really made them feel particularly vulnerable about seeing doctors. But everything that I do, I am trying to minimize their discomfort and make them feel safe in this space. It's really an exciting challenge when I'm dealing with a special needs patient because they're really so dependent on you. There's an extra element of vulnerability there. And so I need to make sure they feel really comfortable. And it's not as simple as just watching the verbal or physical cues from somebody. Something that you think is really nothing might cause this person unusual distress, and I just don't want to do the wrong thing. Because sometimes if you do one wrong move, then it's game over and you can't even proceed, right? Like it's like the door is shut.
I want to get this over with.
We're working on it.
Yeah.
You're tired of being here? Ready?
Sit down.
Okay, so what's going on here? What brought you over here?
Jordan has angiofibroma on his face.
Angiofibromas, I see. Okay, yeah, so angiofibromas are benign growths, but they can continue to increase in number and size throughout your lifetime. And I see some of them have been bleeding recently, huh?
He's been picking at them.
Oh, so you don't like them, or they itch?
Yeah.
I see, okay.
Jordan has something called tuberous sclerosis.
Okay. Tuberous sclerosis is a pretty rare condition. It's due to a gene mutation, and people with tuberous sclerosis can have multiple benign tumor growths in various organ systems. About 50% of people with tuberous sclerosis have some level of developmental delay, and a good number of them present with angiofibromas. Jordan, you are interested in maybe us removing some of these?
Yeah.
Have you ever had to have these treated before?
Well, when he was probably 3 or 4, they did an inpatient laser treatment and literally burned his face. I mean, this was a lot.
Okay.
So, I mean, his whole face was black.
That's scary, too, for you guys to see. Can I take a close look and see? Do you mind if I do that? Let's take a look at what you got here. Oh, my goodness. I can see why you pick at that, because it's sticking way out. And it's mainly the ones right there around your nostril there. But I feel like the ones that mainly bug you, obviously the ones that are raised up, huh?
And that one that hangs off the...
Hang off the edge like that, like a little lamb chop you got there, huh? Ah, you have a nice-looking nose, too. Jordan really is presenting with classic angiofibromas, and because his life would be so improved with bleeding and infection, I've got to try to get the biggest ones off. So I'm gonna use surgical scissors and electrocautery because I think that that's going to be the most efficient way to do this. And I'm concerned because he's had some bad experiences in the past, so he's really is fearful of having anything done with them. I think what we want to do is try to get rid of the big raised ones. And I do think that me gently taking them off flush with the skin is better than any laser.
Okay.
But how do you think he's going to do with this? Do you think he'll be able to sit still for it?
He'll need a little hand holding.
Yeah, I'm going to get you involved too,
Yeah.
yes. So, you know, you can poke away at mama, okay? Just don't, oh, well, you don't have to do it now. You don't have to practice now. Well, make sure you're nice and comfortable, too. That's the most important for me, okay? Maybe we'll put some numbing cream on you early here, too. And make sure they're nice and numb. Okay?
Okay.
Okay. So you see that there are like little spots there, but they're flat. They'll heal up.
Yeah.
There you are.
I wasn't really sure what would happen when we got here, but I'm very relieved. I'm very happy. There will be less bleeding, and I'm not as worried about his infection as I was before. Oh, we're picking her today?
Oh, she's a feisty one.
Is she now? It's been 2.5 months since we saw Dr. Lee, and Jordan looks amazing. The spots have healed up nicely. He didn't have any pain. How does your nose feel now?
Excellent.
Excellent.
Yeah.
Okay. As you can see, no more blood on the walls. Jordan no longer picks at his face. There's no longer blood on the pillows, and I'm not worried about infection any longer because there's no open wounds.
Thank you, Dr. Lee.
Dr. Lee was great with Jordan, and in fact, he still has a huge crush on her.
Hey, yeah.
Heck yeah.